You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, sleep apnea. New treatment options for people that want to get rid of their CPAP. A new effective treatment that is being used by dentists across the country and medical doctors working with dentists. With us, we have an expert on the topic, Indiana's dentist, Dr. Greg Pyle. Dr. Pyle, welcome to the program.
Oh, thanks for having me, Randy.
Now, before we get into today's topic, for people that don't know about your practice and about you, tell us a little bit about your practice. I guess you grew up in the area.
I grew up in Muncie, Indiana, which is an hour outside of Indianapolis, and it's Middletown, USA is what it's called. There have been several studies about how it's very typical of any small town in the Midwest. But I grew up there. I went to a local university, Ball State University.
Aren't you the team
dentist? Yes.
Is that
so
right?
we handle all the mouth guards and any injuries and so forth for all the athletes at
So you
the
make the
university.
mouth guards?
We do.
But these are like special?
These
like
are custom fitted mouth guards for the football team and
good.
other athletes too.
So you get free tickets and all that stuff?
Yeah, we get to pull up close to the stadium when there's a game, so it's nice.
All right. Now, now your practice. You know, I've had you on the show before talking about cosmetic dentistry, but I guess you do everything.
We do, and we talked about last time, we see kids and we see adults and older adults, and we do a wide range of different procedures. But a few years ago, I was introduced to this idea that jaw position and how it opens the airway and how dentists could help patients not just come up with a better way than the CPAP, but also just to get a good night's sleep and how that affected their whole life.
Okay, and you know, I invited you on the show to talk about this no more CPAP.
Right.
But CPAP works.
CPAP
Is that correct?
CPAP definitely works
For sleep apnea patients.
For sleep apnea patients, and but it's hard. That's the big thing. And there are a lot of CPAPs, as I say, parked in a closet somewhere because it's just difficult to wear.
They don't like wearing them.
They don't like wearing them. There's some claustrophobia issues. There's some noise issues. There's, quite frankly, a positional issue because it's hard to roll over when there are tubes and wires going everywhere.
Now, we should mention, because at the top of the show, I asked you, have you helped more than 10, 20 people that had to use CPAP get off of CPAP?
Right.
And you said, oh, more than that.
Yeah, more than that.
More than 100?
More than 100, yeah.
Would you say that just about every single person that has come to you using a CPAP, that your treatment has worked for them?
It has. We have one case that didn't go
so
like
it really
we wanted,
has.
but it really helps everybody.
Okay.
It's that said, it only works in certain cases. You have to pick the right cases.
But everybody you've seen, I'm gonna
Yes,
bring this
that's okay.
up. It's worked for everybody you've seen.
It is.
So you're optimistic then about.
Oh gosh, yeah.
But is this a problem in Indiana?
Oh,
sleep apnea.
Yeah, it's unbelievably a huge problem, and people. Well, you see the studies all the time about how obese the United States is compared to other countries. And one of the biggest red flags is obesity for sleep apnea. It's just too much weight on the neck. People lay down, they lose all muscle tone when they go to sleep. The airway closes up, and we have to figure out a way to open the airway.
So I understand this correctly. Okay, so during the day they're able to breathe, they're fine, and it's only when they're laying down at night that they can't breathe.
Right, the muscle tone holds
the airway open. And so you're kind of
open.
opening that bite a little bit?
Well,
opening the mouth?
Opening the mouth, protruding the jaw forward opens the airway.
And they're able to get a good night's sleep?
They are. Yeah.
Interesting. Now, what about medical insurance? Does if a medical doctor refers you a patient, are you getting reimbursement?
Yes, yes. It's a wide range, depends on people's policies and so forth. But, you know, we've seen anywhere from 50% up to 80 or 90% of coverage, and it's less expensive than the CPAP.
Now, we were getting ready for the interview, and we were in the green room because anticipating this interview, I was thinking, is it that big of a problem? You know, people wearing CPAPs, because I don't know anybody wearing a CPAP, right? Oh. And so right in front of you, I Google it. It's a $4 billion worth of CPAPs are being sold a year. $4 billion.
Yeah, you don't think you know
So I said, there must be people that I know.
I guarantee it.
Right?
And it's not something, you know, we don't want to tell people that we snore all night or that we don't have energy to do things during the day. You know, all of us want to be positive people. So we go to work and we you know, if you have a sleep issue, people find their way to fake their way through the day.
Okay.
And we don't want people to fake their way through the day.
So you've seen transformations. Give me a patient example of somebody that comes to you for for sleep apnea, and how do they hear about you currently?
It can come from referrals from physicians. It can come from referrals from other dentists who know that we make the appliance and they just haven't gotten into that area yet. Some of them are our own patients, and they see on our website, you know, hey, I didn't know you were doing the sleep apnea stuff. And so they come from a broad range. One story in particular, and this guy is one of my dear friends. We were childhood friends, and we've grown up together, and he knew he had a problem, but he wasn't sure, and we did a sleep study on him, and he had a huge problem.
So a sleep study?
Yes.
So they go to a local... Help me understand that.
Yeah, a sleep study is done either at a sleep lab where you're monitored all night long, and they actually physically count how many times did you stop breathing every hour.
Because these people think they're sleeping.
They think they're sleeping.
Is that right?
And they're not. They're not. New on the horizon is a take-home version of the sleep study. While it doesn't give us quite as much information as the in-lab study, it still gives us the number of times that they stop breathing during the night. And that's a huge item in that I think we're moving more that direction because it's simpler. This friend of mine, he didn't want to go to the sleep lab. He didn't want to spend the night with wires hooked to him.
Yeah.
And so he did the home sleep test. And it came back that over 60 times an hour, he stopped breathing for 20 seconds at a time.
Really?
Yeah, and it was an eye-opener for him. He didn't believe that he wasn't breathing at night. He just knew he was tired a lot during the day. And I pointed out to him because we're friends, and we'd go to a game, a football game, and I'd look over and he was dozing off in the middle of a football game. And I said, "How can you do that?" "Well, I'm just tired. I'm working a lot." Well, he was working a lot, and he wasn't sleeping.
Okay.
So we took it from there, and
we talked him into it.
We talked him into it, and I said, you know, we just need to open your airway. If there's a way to open your airway at night when your muscle tone goes down, is there, you know, are you going to sleep better? Well, come to find out, he does.
Okay. So you made him an appliance.
So we made him an appliance. Literally the next day, he called and said, you know what? I didn't get up to go to the bathroom last night.
Okay.
I slept through the night. The first night, he slept through the night. Now, as we went along and made adjustments, he slept even sounder. He slept even more as we went along. And it's been a really neat transformation, not just because we helped a person out, but we helped a friend out too.
Okay.
And, you know, this is somebody who now has more energy. You know, here we are roughly 6 months from the time we did it. He's lost 80 pounds plus.
Really?
He can go to the gym now.
Does he give you credit? I mean, the fact that he's sleeping now.
Yeah, yeah, yeah. And,
interesting. Well, it makes sense. I mean, if you're sleeping,
you're going
to have more energy the next day.
You have more energy the next day. You know, there's not all those bad chemicals being built up.
80 pounds, 80 pounds.
80 pounds is a lot. And I'm so proud of him. He's doing really well. And
you say that oftentimes the spouse drags the husband in.
Exactly. We have countless stories. One in particular, a lady brought her husband in. In her terms, he could suck the wallpaper off the walls. Okay? They hadn't slept in the same room for years because she just couldn't sleep. She was tired of sleeping in another room. She wanted her husband back. She wanted their relationship back. And reluctantly, he came in. He didn't want to go to his physician. He was another one that didn't want to do a sleep study, but he actually went for a full-blown sleep study for us. And once he had it and had his eyes open, said, "Oh my gosh, this is a big problem."
Was he diagnosed that he had to have a CPAP?
He was diagnosed that he could either have a CPAP or he could try the dental appliance.
Okay.
He went with the dental appliance, and he's another success story for us. In that his wife says they're sleeping in the same bed together now. He doesn't.
So the snoring goes away?
Snoring goes away as well.
Really?
Yeah. Once that airway is open, there's none of that fluttering of the airway when they breathe in at night. So it's really nice.
Now this has become more and more mainstream. I told you I was at I guess the largest integrated medicine conference of all, the American Academy of Integrated Physicians, or Anti-Aging Medicine. The medical doctors, I sat through a lecture, and they're saying, find a dentist that understands this.
Right.
Even before the CPAP. Because I guess, but everybody so far that you've had a success rate with.
We really have.
How'd you get involved? How'd you get involved?
Well, you know, again.
Were you skeptical also?
Of course. You know, first off, you know, this opens up a whole generalization as far as conversations you have with your patients. You know, it's one thing for me to look in and look at their teeth, and you know, patients are accustomed to that, and that's what they get. It's another thing for me to lean up and talk to them about counseling, about weight loss, and so forth. You know, they're not accustomed to their dentist having those conversations with them, and so it took some new ideas and new verbal skills and so forth for me to sit down and talk to patients about these
Could
things.
you visually see as a dentist this person might have sleep apnea?
Oh, yes.
You can?
It's easy. You
Oh, really?
See dark circles under the eyes. You see when you say open up and their tongue retrudes back into their airway. So you know when they lay back flat, it does it even more. They're usually overweight.
So do people actually tell you I'm on CPAP, or I have a CPAP, or I have it on in my closet?
Yes, yes, we hear that a lot. Oh yeah, my doctor told me a long time ago that I had sleep apnea. I said, well, are you doing anything for it? Well, I have this CPAP. Well, okay, let's take it a step further. Do you wear the CPAP? No, I don't like that thing. You know, that's usually the biggest complaint. Is
so they have to sleep with it.
Yeah.
It's like a vacuum, but it pushes air into your...
I heard this analogy once, and this is a great analogy. It's like you have a dog. Or do you not have a dog?
Yeah.
Okay.
Yeah.
So
I don't have one right now, but I've had dogs.
So they're in your car, the windows roll down. What's the dog do? Sticks his head out the window and goes like this.
Yeah, yeah.
Exactly what the CPAP does. It's just blowing air, continuous positive air pressure is what the CPAP stands for. So it's just...
And it plugs in the wall. I've never seen one.
It plugs into the wall.
Pictures.
So it's, like I say, it's just blowing air down your throat all night long. So and they have made advancements.
You have to sleep on your back for the most part.
It's the easiest to sleep on your back.
Okay.
And I don't know about you, I can't sleep on my back. I have to sleep on my side. It's the other difficult thing is a high number of people who have sleep apnea sleep on their stomachs. Well, they can't sleep on their stomachs with the CPAP, and it makes it very difficult for them.
Okay. So now, have you had people that literally are resistant? Maybe, like you say, their spouse, where they're on the CPAP, and even they are surprised that they don't need it anymore.
Yeah, they are really in shock that there's another option, because a lot of times they get the CPAP and maybe they just haven't been back to their physician for 3 years. They haven't been sick. The CPAP seemed to work. They hate it, but they begrudgingly drag it along with them when they go on trips. Their spouse, maybe, yeah, you solve the snoring, but the noise of the CPAP, I'm sleeping in another room still.
Okay.
So those are the issues with the CPAP, and then they come into our office and they say, oh, you mean there's another option? And we show them the appliance and how simple it is.
And it works. So when medical doctors are watching this, what do you want them to know about this appliance therapy? What do you call it? I'm calling it appliance therapy. What do you call it?
Yeah, that's exactly what we call it, appliance therapy, dental appliance therapy. There's all sorts of names for them out there.
But they work.
They work. They work.
And so you need the medical doctor to write a prescription for it to be covered by their medical insurance.
Correctly.
What about dental insurance? Will it cover part of the cost or not at all?
Not at all.
Interesting. So just get the medical doctors. Do you do any awareness, or do you reach out to the medical doctors in your community?
We definitely do. And we really like to work hand in hand with the medical doctor, because I don't want them to think we're trying to take over their patient and treat them for everything. So we get in touch with the medical doctor and tell them, okay, here we have a patient on CPAP that you prescribed 3 years ago, and by the way, they're only wearing it 2 nights a week or 3 nights a week or whatever it might be. And we have an alternative, and let's see what you think. And here's what I think could work. And we throw that past their physician. We work hand in hand. The patient knows it's a team approach.
But even a really bad case, my son and I, we went on this school trip, and it was on a tall ship, and one of the guys had sleep apnea, and he had to sleep on top of the ship because he kept us all up.
Oh yeah.
A guy like that, and he was saying his CPAP, anticipating this interview, that's the only person actually that I've ever known.
Okay.
Are you saying a person like that's even had it for 10 years or 15 years, that possibly a simple appliance?
Possibly.
I'm calling it a simple appliance, but I know there's a lot to it.
Right. But you're right.
Get this guy this is loud snoring. Could take that away.
It really could, and there are
you've had over 100 people that this has worked for.
Oh yeah, and there are obviously cases that are so severe that the CPAP's their only option. those are few
But
and
you
far
haven't
between.
had those.
Well,
I mean, yours have worked.
We've picked the right cases, I guess.
Okay. All right. Is there anything you could do like a trial to, or you have to have a custom fit to find out?
It has to be a
works?
custom fit.
But they also offer these over-the-counter splints for sleep apnea.
Yeah, and they're cheap, and they're cheap for a reason.
Okay.
They're cheap because while they might help some people, there may be a handful of people they help. We don't know to what degree they're helping.
Okay.
You know, they're uncomfortable because they're not custom fitted for that patient, whereas we will custom fit it to exactly fit your teeth. Because they're not monitored, they can do damage to your teeth. You can have
like what?
Like your teeth don't line up anymore. They can have some flaring and so forth.
Interesting. Okay.
So
stay away from those. You don't like them.
Oh no, don't do those at all.
Because yours isn't that much more than an over-the-counter.
Yeah, I mean it's more expensive, but it
works.
It works. It works. Yeah.
Okay, so what's the danger? Because and this is the big topic. Okay, so we're talking, by the way, about no more CPAP for people that are wearing CPAP or people that are really loud snorers. Dr. Greg Pyle says that there is a treatment option that he's offering in his practice that have been helping people, would you say every week? That you take snorers, no more snorers. You take people that have chronic sleep apnea, no more chronic sleep apnea.
Correct.
And these are, do they ever do a follow-up sleep study to prove that it works?
Yes, that's
really?
That's how we know it works. So once we get the appliance in the right position, or what we feel is the right position, then we do a follow-up sleep study. And we're recommending that every couple of years they do a follow-up sleep study, because what if they gain 10 pounds, or what if they lost 10 pounds? Maybe we have them out there too far.
Okay.
So we want to monitor that over time.
So give me a great story. Okay, so you told the story of your friend. He was up 60 times in an hour.
Yes.
Or not breathing 60 times in an hour.
Right.
So have you ever made an appliance for somebody, custom appliance? They go to the sleep lab and what? Like, what are the numbers?
They were single digits. It was really quite a transformation, and they were up in the, maybe the 20s or near 30 times an hour where they would stop breathing during an hour, and now they were down at 4 or 5. Five is considered normal, actually. 5 and below. That people just, for whatever reason, stop breathing. They get so
these
relaxed.
Numbers are real. I mean, you have the science behind this, and okay, so. They know, I guess medically they know that if you're not sleeping, you're going to raise stress hormones.
Yes.
That will make cortisol make you fat.
Right.
There's heart disease links, diabetes, hypertension, blood pressure. I mean, everything.
It's all over the board. Yeah.
Do you have stories where the patients say, okay, hey, Dr. Pyle, since my husband did this, the numbers are better?
Yeah. We have one patient in particular that was on a high dosage of high blood pressure medication. He tried the CPAP, couldn't do it, decided we'd try this. This, in his mind, it was a last-ditch effort, probably because his wife dragged him in.
Just to make his wife happy, maybe.
Yeah, to make her happy. He stopped snoring. But not only did he stop snoring, he was sleeping through the night. Things like not getting up to go to the bathroom, a good night's sleep, more energy the next day, not nodding off when he was watching TV, or not nodding off if he's a passenger in a car. Those things were all improved. But even better yet, his blood pressure medication, which was at a high level, although he's not completely off of it, it was at a super low level, like a minimal entry level.
So now on the consult, you say, okay, you're a good candidate. What's the turnaround time to get it made? And I guess that's what that is.
Yeah, you want to take a peek?
Yeah, let's take a look.
Yeah, it's nice because it's small. It's small and very lightweight. Feel how lightweight that is.
Yeah.
Okay, there's a piece for the top.
It's almost like an Invisalign kind of a...
Yeah.
Or at least to me it looks like that.
Yeah, and there are little adjustments on the lower one, and what we do is we change those adjustments out to protrude the jaw forward a little bit. Okay, but it's real nice and lightweight.
It seems so simplistic, by the way.
It does.
And it does work.
It does work. It definitely does. We have lots of stories of
Are doctors ever surprised? I mean, a medical doctor that says they poo-poo it, they say it's not going to work, and then they go, I'm surprised. Because they look at the sleep study.
They see the sleep study. The story's in the numbers. The story's in the numbers at the end of the day. So we have lots of patients. And the big thing we talked about earlier with CPAP and how patients don't like the CPAP. And I think so many of them don't even know there's another option for them out there. And this is such a simple option. We have countless patient after patient after patient who comes in and says, if you can make this work so I can get rid of the CPAP, you're going to make me the happiest guy on the face of the earth.
Would you say over 70 people you've had come off the CPAP?
Yeah. Yeah.
Really?
Yeah. And there's wonderful stories about.
But you know, look, logically, and I was trying to put myself in the shoes of a person with CPAP, but you know, we've all had a night where we didn't sleep a lot, and the next day we're edgy, right?
You're edgy.
You're actually hungry.
You're hungry all day.
You know, you're just not in the mood to do anything.
Right.
And
you get to about 3 o'clock and you
your
can't
motivation
function very
gone.
well anymore.
So these people live like that all the time.
Right.
So when you get them back to sleeping, everything changes.
Everything changes.
Is this the happiest group of patients, by the way? Because I know you do a lot of cosmetic and you change people's lives, but these people that you take off that machine, it seems like they've got to be.
It's really life-changing for them, and I would probably venture to say they are happier, because it's not just affecting their teeth, you know, like we do with cosmetic cases, which is a wonderful thing. This is affecting their whole day, and it affects how they eat, it affects how they exercise, it affects how they work, it affects how they, you know, their partnership with their spouse, the whole 9 yards.
Guys like to wait till they absolutely have to do something, especially to go see the dentist. Speak to the wives for a moment. Give us the symptoms of the snoring, and you know, when should you get your partner or whatever to come in and do something about it?
Okay. The typical red flags. I mean, the three biggest ones are snoring. Number 2 is that for a man, the neck size is 17 or above.
Okay.
Okay. And high blood pressure. If you have 2 of those 3 things, you better get him into his physician or to us to.
Because that could ruin a marriage. I mean, they start sleeping in another room.
Yeah.
Because you can't. I mean, look, I've been in hotels where a person is
hear it through
snoring
the
in the
wall.
next. Yeah, and you can't sleep.
Yeah.
So I can imagine living in the same house.
Yeah.
But that goes away. You say.
That goes away.
You think you've saved a few marriages?
I think so.
Have they ever told you?
They haven't told me that per se, but
I mean,
but they have told me, hey, we sleep in the same room now.
Okay.
Isn't that a neat story? You know, after 15 years of not sleeping in the same room, we're back to sleeping in the same room.
And they report more energy.
Yes,
things
definitely.
like that.
Yeah.
They become more active. So what do they want to know? Okay, so a CPAP patient comes in. Do they come by themselves or do they come with their partner?
We've had both. We've had both, yeah.
What do they want to know every time? What do they ask?
Every single time they say, 1, does it work? And number 2, how do I know I can wear it? Because, hey, they can't wear the CPAP. So they're frustrated to begin with. So they say, am I going to sink some more money into this, to another project that's not going to work? Well, like I say, I'm here to tell you, we've had 1 case that couldn't wear it, and she was a different case. Probably.
So you've had a high satisfaction.
Yes, yes. The studies that SomnoMed puts out on their own appliance is
give me some of their stuff.
Yeah, their stuff. Over 90% of the people can tolerate it and can wear it every night. So it's only worn at nighttime. Some people have that question too. Do I have to wear this thing all day long? And you know, no, it's just a nighttime appliance. They wear it during the night. We want them to wear it every single night though. We don't want them to wear it 2 nights a week like some people do the CPAP. Well, yeah, I didn't get a good night's sleep last night, so I think I'll put in the CPAP.
Do you have any, aside from that one personal friend, do you have any other friends that are using this?
My dad. That's
Is that
about as close as it gets. Yeah.
How come you didn't want to tell me his story? I didn't know about your father.
Well,
was he at the CPAP stage, or you got him early?
No, he was at the CPAP stage, and because we're still developing. I mean, we haven't done his post-op studies yet. So.
Okay. So, well, tell me about him. I mean, it worked?
It's definitely worked. He's sleeping, and he's wearing it, you know, unlike the CPAP, which he said, you know, I just can't wear it. He just couldn't do it.
Are there any misconceptions, by the way? Like the patients come in and they say, yeah, but isn't it true this and isn't it true that? Or what could an expert argue with you today about what you've said?
Well, you know, I think the big thing is we know the CPAP works. There's no argument about the CPAP working. We know it works. Only if they wear the CPAP, though. That's the big thing. And when you have over 90% of the people who can tolerate this appliance, we know they're going to wear it. And there's study after study now that is showing that the appliance, especially in mild and some moderate cases of sleep apnea, is just as effective as the CPAP. So, you know, we want patients to breathe on their own. We don't want to force air down
So
there.
in Indiana, you think in your town there's more than 500 people using CPAP?
Hey, you know, there's, I don't know, somewhere in the neighborhood of 60 to 65,000 people in our town. I would say, you know, 30% of those people have been diagnosed with sleep apnea.
And if they do this, okay, so let's give a recap of benefits. I mean, it sounds good, and I'm not trying to endorse you here, but so you're saying that these people will get a better night's sleep.
Mm-hmm.
They're going to breathe better.
They're going to breathe better.
And if they're getting a good night's sleep, their blood pressure goes down.
Right. Their risk of heart attack, sudden death, heart attack goes down. Randy, 90% of people who have strokes have some form of sleep apnea. 90%, which is huge. Anything we can do to lower that rate is going to be monumental.
What about 80 years old? Is that too old to get this done?
No, no. If I'm 80, I want to keep living. How about you?
Okay. Now, what if you're a denture wearer?
Mm-hmm.
Not a candidate at all?
Yes, you are a candidate.
Really?
Yeah. There are cases. My dad's a good case. He has an upper denture. Okay. He has implants that hold the denture in. We attach this right to the implants that hold his denture in. So this takes the place of his denture at nighttime.
Is it rare, by the way, is it less common that denture wearers have sleep apnea? Or they have the same problem?
I would say they'd have the same problem. Okay.
And you could help those people too?
We can, yeah.
Okay, good. Well, thank you for coming on the show. Final message. Somebody, again, they are skeptical.
Okay.
What do you say to them?
If you're skeptical, don't be, first off. If your spouse or you, or if you're a snorer, if you have high blood pressure, women neck size of 15, men 17 and above, you need to have this checked out. Don't put it off. There are so many items that can creep up on you that you don't even realize are happening because you're not getting a good night's sleep.
In the consultations, they'll meet with you.
Yes.
And they'll know within half an hour whether they're candidates, in your
about
opinion.
45.
Well, thank you for coming on the show.
Yeah, thanks
so
much.
Very interesting.
That's awesome.
And by the way, do you have information about this on your website?
We do. Go to just drgregpyle.com and click on the sleep apnea tab.
Okay, no more CPAP.
No more CPAP.
All right. Yeah. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website. Just put in Dr. Greg Pyle or Dr. Pyle. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.